Hi everybody, my name is Senior Airman Lawrence Corson. Today I'm going to talk to you about gastroparesis.
Woo!
So, imagine not being able to have a juicy steak, not being able to start your day off with a nice cup of coffee, or not even being able to enjoy any Brussels sprouts that your grandma's always been telling you to eat. These are three really common occurrences if you suffer from gastroparesis. So today I'm going to educate a little bit about what the disease is, why I think it's important for people to know about it, and a little bit about my personal story with it. Well, I don't suffer from it. My wife, for the past 6 years, has had the disease, and we've had to make some adjustments in our life to live with that. So, first of all, gastroparesis. If you break apart the name, there's gastro, stomach, paresis, paralyzed. What it means is your stomach doesn't fully digest food, and that leaves you feeling heartburn, indigestion. You're gonna eventually get full in your stomach, and you're gonna want to puke it all back up, which is going to lead to weight loss because you're never going to be able to really stomach anything. This is usually caused by fiber. So early on, some of the treatments, you can just have a low fiber diet. That's why you can't have meat, can't have really green vegetables. Eventually what's going to happen is your stomach's just not going to tolerate anything, and you have to have medication to handle the nausea. Medications usually work for a while. Some kinds of gastroparesis will eventually go away after 6 months to a year. Others you just live with for life, especially with diabetes, and eventually it leads to death if you can't get any nutrition anymore. Some treatments other than medication: you can have surgery to install a feeding tube, just bypassing the stomach altogether. You can have a clamp put on your stomach, especially in really obese patients. They're going to need a gastric bypass anyways, and that'll make it so that that part of the stomach isn't being used, but the rest is still fine. Other than that, you can do what's called a gastric neural stimulator, which I'll talk about a little bit later, and that can work. Now you know basics of what the disease is. I'm going to talk about why I think it's important. The main thing is just that very few, even medical professionals, know much about the disease. They kind of just associate it with diabetes as a byproduct, and there can be, it's called idiopathic gastroparesis, which basically just medical speak for they don't know why it's there, but it is. And it can take a really long time to diagnose because of that. And with more awareness, hopefully there can be more money for research, more drugs that work a little bit better, don't have as many side effects, and maybe sometime in the future, some of you will have gastroparesis, and you can maybe even help the doctor diagnose it a little bit early. So, for my personal story, my wife was diagnosed about 6 years ago. She'd been for about a year just losing weight, couldn't keep anything down, super, super skinny. I don't think any of you have even seen photos of her, but she was like 90 pounds at some point, and she doesn't weigh that now, just her. It's crazy. Eventually what happened, they did diagnose it. They did a gastric emptying study where they have you eat some radioactive material, and then they watch it go through your stomach, and they're like, oh, normal stomach would digest that in 3 hours, it took you 12 hours, and that's why you feel sick all the time. They put her on a medication called Reglan, and that worked for a little bit, and then she started having seizures, and basically a whole month of her life she just had seizures constantly because of this medication. It's really strong stuff, and that it can have pretty severe side effects. She then tried an experimental one called domperidone or something like that, and it was experimental, so after a few months they saw it was kind of messing up her heart rate, and she had to be taken off that immediately. So she just went for a couple years then with no medication because nothing else was really out there for her. A couple times I was with her and the doctor was like, yeah, you're just gonna die when it gets too bad. That's pretty hard to hear. But when we came to Oklahoma, we were actually able to meet with a surgeon who was gonna install that neural stimulator I talked about earlier. And what that does is it doesn't really fix the issue, but it tricks your brain into thinking you're digesting. And so you don't feel the nausea, and you can go out your day. If you eat and then just don't eat again for a little bit, eventually you will digest and you'll be okay. So she had that in December of 2017 installed. It was a pretty big surgery because they go into your chest cavity, install it on your stomach and down in your lower abdomen as well for a little battery pack. But ever since then, she's been pretty much normal. She still can't have a whole bunch of alcohol. She gets food poisoning every time she has meat, but other than that, she can live a pretty normal life, and it's been life-changing for us. So, that's gastroparesis. I talked a little bit about what it is, why I think it's important, and a little bit of my personal story. Hopefully you all learned a little bit of something new today, and if you ever meet someone with gastroparesis, hopefully you don't, but now you know how to deal with it. Thank you.